This is Manubrium sternae. This is thick upper border. Upper border contain, this is jugular notch, this is clavicular notch. Here the sternal end of the clavicle is attached. From saddle type of synovial joint, the articular surface of saddle type of synovial joint is concavo-convex, and here a articular disc is present. This is lateral border. This is another lateral border. This is oval inferior border. Oval inferior border is articulate with body of the sternum. This is the body of the sternum, and inferior border is articulate with body of the sternum and form sternal angle, which correspond with the lower border of fourth thoracic vertebra, and its form sternal angle. This is the sternal angle. Like this, sternal angle is formed, and behind the manubrium, the superior mediastinum is present, and behind the body, inferior mediastinum is present. This is the anterior surface of the manubrium sternae. It is rough. This is the posterior surface, and this surface is concave and it is relatively smooth. The anterior surface of the manubrium from side to side convex. You see, side to side convex, and above downward concave. Above downward concave. So this is the anterior surface of the manubrium. Here pectoralis major muscle is attached, and here attachment of the sternocleidomastoid muscle, which is supplied by the spinal root of the accessory nerve, and pectoralis major muscle is supplied by the median and lateral pectoral nerve. This is the lateral border. Here first costal cartilage is articulate and form a sternocondyle joint. This sternocondyle joint is the primary cartilaginous joint. Is later part of the development, it's converted into bones. So there is no joint between first costal cartilage and manubrium sternae. This is the second chondrosternal joint. This is the plain variety of synovial joint. And this is sternal angle. This is manubriosternal joint. This is secondary cartilaginous joint. So this is the posterior surface of the manubrium. Here right and left pleura is related here, and two muscle is related here, sternohyoid muscle above and sternothyroid muscle below. Now the relationship of posterior surface, posterior relation of the manubrium sternae. The lower half is related with arch of the aorta, and upper half is related with left brachiocephalic vein and branches of arch of the aorta. So this is arch of the aorta. This is left brachiocephalic vein. It goes from the left to right side because the right and left brachiocephalic vein from the superior vena cava, which is situated in the right side. So left brachiocephalic have to cross a long distance. That is why it is longer than the right brachiocephalic vein. So like this, sternum is manubrium sternae is related. Its lower half is related with arch of the aorta. Upper half is related with left brachiocephalic vein. brachiocephalic trunk, left common carotid artery, and left subclavian artery.